In this video, we will be reviewing the next generation NCLEX topic on pneumonia. This covers the pathophysiology of pneumonia, types of pneumonia, the signs and symptoms, diagnostic tests, nursing interventions, and patient education. Let us start with the pathophysiology. Pneumonia is an inflammation of the lung parenchyma caused by various microorganisms, including bacteria, fungi, viruses, and mycobacteria. It causes the alveoli to be filled with fluids, debris, and mucus, hence leading to decreased gas exchange. The alveoli is the primary site for gas exchange with pulmonary capillaries. Pneumonia can be community-acquired or hospital-acquired. It can also be infectious or non-infectious. Types of pneumonia. Healthcare-associated pneumonia, HCAP, is often caused by multi-drug-resistant organism, MDROs, and most times they are very difficult to treat. Ventilator-associated pneumonia, VAP, is more common among patients on mechanical ventilation and occurs more than 48 hours after endotracheal intubation. Bacteria pneumonia is more severe than viral pneumonia. Pneumocystis jirovecii pneumonia, PJP, is a fungal infection that is most common with human immunodeficiency virus, HIV, patients. Community-acquired pneumonia, CAP, is the term used when a patient gets pneumonia in a community setting outside of the hospital setting or have not been hospitalized or resided in a hospital setting with 14 days of the onset of the symptoms. Hospital-acquired pneumonia, HAP, also known as nosocomial pneumonia, is mainly caused by poor hand hygiene. This type of pneumonia is not present at the time of admission, but occurs 48 hours or longer after hospitalization. Aspiration pneumonia can be caused due to aspiration of normal flora from nasopharynx or oropharynx. Opportunistic is most common among immunocompromised patients. Streptococcus pneumonia is caused by bacteria infection and can be detected with blood culture. Legionella pneumonia is caused from inhaling water droplets containing Legionella bacteria, drinking contaminated water, or inhaling contaminated soil, and patient may have diarrhea. Viral pneumonia is most common among children and has no definitive treatment. It may be mild or life-threatening, and antivirals may be used for the treatment. Signs and symptoms of pneumonia. Patient with pneumonia may experience pleuritic chest pain with coughing or with deep breathing. Cough may be productive with yellow, green, or rust-colored sputum, or non-productive dyspnea, shortness of breath. Tachypnea, altered mental status or stupor, is very common among the elderly patients aged 65 years or more. Fever is very common, 100.4 Fahrenheit of 38 degrees Celsius. Chills, rhonchi, wheezes, and decreased oxygen saturation is very common. Fatigue, headache, nausea and vomiting, loss of appetite, diarrhea, the diagnostics tests. Students should pay attention to key words in the question STEAM because symptoms may be used to support the assessment findings. The chest X-ray film may show pulmonary infiltrates which may be localized, lobar or segmental consolidations, which are the gold standard test for diagnosing pneumonia. Chest X-ray may be repeated in 6 to 8 weeks. Sputum gram stain, culture, and sensitivity should be used to identify the causative organism before administering antibiotics, and a sterile cup must be used for the culture. Complete blood count, CBC, with differential may be done to monitor the white blood cells. Arterial blood gas, ABG, can be used to monitor the level of oxygen and carbon dioxide in the blood. Nursing interventions, improve airway patency, monitor pulse oximetry, and administer oxygen for hypoxia as prescribed. If patient is having pleuritic chest pain with coughing and deep breathing, nurse should administer analgesics to relieve the pain. Administer pneumococcal vaccine to all adults 65 years or older and 19 years or older with chronic disease that weaken the immune system.
Antitussives for cough, monitor the phlegm and document accordingly. Antipyretics for fever, bronchodilators, cough suppressants. Administer antibiotics as prescribed for bacterial infection. Administer antiviral as prescribed for viral infection. Administer antifungal for fungal infections. Maintenance of proper fluid volume is very important. Nurses should monitor intake and output, encourage up to 2 to 3 liters of fluids to thin and loosen secretions unless contract indicated. Place patient in semi-Fowler's position to expand lungs and facilitate breathing. Offer tissue to patient for secretions and dispose the tissue properly to prevent the spread of the infection. Maintain proper hand washing.
Patient education. Encourage coughing and deep breathing, and use of incentive spirometer 10 times every hour while awake to prevent respiratory complications such as atelectasis in the post-surgical patients. Early ambulation should be encouraged for post-operative patients to prevent complications such as but not limited to atelectasis. Also evaluate your patient's activity tolerance level and provide a balance of rest and activity for patients. Encourage small, frequent meals with high-calorie and high-protein food. Patients should be encouraged to quit smoking because it damages the ciliary cleansing mechanism. Also remind them to stay away from secondhand smoke. Take all medications as prescribed and notify the primary care provider if you have chills, fever, dyspnea, hemoptysis.